Well, welcome everybody to today's webinar about lessons from social science and community engagement with vaccine trials. We'll be hearing from community engagement practitioners and social scientists who have conducted research and community engagement during vaccine trials, and how their work has highlighted the social context in which these trials are conducted. And we hope from this we can learn lessons for the COVID-19 vaccine trials. This webinar is organised by the COVID-19 Clinical Research Coalition Social Science Working Group. The coalition itself was formed in April of 2020 by clinical researchers and scientists in response to their growing concern about the impact of COVID-19 on health systems around the world, and that the COVID-19 related research priorities of low resource settings would not be adequately supported or prioritised. The coalition is leveraging global expertise to advance high impact COVID-19 research in low resource settings, including through its 13 expert working groups. It advocates on the issues of concern to its members, promotes open sharing of research knowledge and data, and champions equitable and affordable access to the vaccines, diagnostics and treatments proven to be effective. If you want to learn more about the coalition, then please look in the links that we're sharing in the chat. I am Shelley Lees. I'm a medical anthropologist based at the London School of Hygiene and Tropical Medicine. I've been doing anthropological research on vaccine trials, as well as epidemic response over a number of years, including HIV, Ebola, and now more recently COVID-19. As I mentioned before, the webinar is organised by the Social Science Working Group, and I'm one of the chairs with Dr. David Kawa-Mafagiri. Here's the other. Unfortunately, he's not able to join us for the beginning of this webinar, but hopefully will join us later. You can find more information about our working group on the coalition's website, which will also be in the chat. Our working group, the Social Science Working Group, is focusing on 4 key priority areas from social science perspectives for COVID-19 research, including COVID-19 clinical trials. These priority areas include political economy, clinical trials and vaccine deployment, transnationalism and vulnerable populations, and preventative and healthcare seeking behaviour. I'm delighted today that we have 4 experts to speak to us. Their expertise is at the intersection of social science, community engagement and clinical trials, and together they have worked in a range of contexts. Following their brief introductory remarks, there will be a moderated discussion, during which time we will take questions from the audience. We strongly encourage all attendees to engage with us and with each other. So we really would very much like this to be a discussion. But initially we will have a discussion with the panelists and then invite you to ask a question. A couple of housekeeping points. Today's webinar is being recorded and will be posted later on the Coalition website. Please ask questions in the Q&A tool at the bottom of your screen. You can also upvote people's questions by clicking thumbs on an icon, which will send these questions higher up the list, and that will be helpful for me to moderate those. If you'd like to address a question to one of the speakers in particular, please be sure to include the speaker's name with your question. And we will be taking, as I said, questions throughout the roundtable. So without much ado, I would now like to introduce our first speaker, Mr. Mahmoud Bangura, who I've been working with for many years. I'm very excited to hear from him. Mahmoud is a social scientist based at the University of Makeni in Sierra Leone. He currently works on the Epivax Alone trial, which studies an Ebola vaccine. Mr. Bangura has a background in community engagement and social science research during the vaccine trials. Mahmoud, can I ask you to do your introduction?
Yeah, thank you very much, Professor Lee, for giving me the opportunity to to serve. And of course, as she had actually mentioned, good afternoon, everyone. So I am Mahmoud Arun Bangura, a master's student at the University of McKinney, pursuing sustainable development. And I have actually been working for the Ibovac vaccine trial alongside the Prevac vaccine trial, all in Sierra Leone, in Cambia district. You know, with the Ibovac starting in 2015 to date. Actually, our key responsibility or aim of the social science trial in the Ibovac Salon trial is basically to study the trial and the Ebola using the Sierra Leone context. And our objectives have been actually to try to study people's health-seeking behavior, their rumors, perspectives, their concerns, and experiences, you know, as they take part in the clinical trial. Actually, yeah, we have been conducting this research for about 5.5 years now. And our actually main data collection methods have been, you know, using like ethnographic observations, in-depth interviews, focus group discussions, key informant interviews. And of course, these data collection methods, basically, first of all, one has to do with giving feedback to the trial about what community perceptions have been, and to see how best those concerns raised by the community could actually be tailored together with the work of the community engagement to see how proper messaging could be given. And it's also kind of also our other responsibility to ensure that the data collected and analyzed and also actually get them prepared for publications, etc., etc. So it has actually been a very interesting kind of work we have been doing, you know, over this couple of years. And actually, I'm really privileged and happy to be part of this webinar and to share my kind of experience that I have gathered over the years. I want to thank everyone for listening to me, and we hope to have a much more fruitful discussion. Thank you very much.
Thank you so much, Mahmoud. Our second speaker now is Ms. Noni Mumba, who's the Head of Engagement at Kemri Wellcome Trust Research Programme. She's been leading the engagement platform for the last 7 years and has over 15 years combined experience in health communication and engagement. Noni, can I hand over to you?
Thank you very much, and it's a pleasure to be in this webinar. And hi, everyone. Thank you so much. So as Professor Liz has said, I work for the Kemri Wellcome Trust Research Program, have been there for the last 7 years. Now, on the left-hand side of the slide is a map of Kenya showing where our research program hubs are. So in Kenya, we border the Indian Ocean. So our headquarters office is in Kilifi, where the red arrow is pointing to. And the bluish shaded area is a health demographic surveillance system area where we conduct a lot of our research work. We also have a hub in Nairobi and another hub in Mbale in eastern Uganda. We are a large research institution with over 800 staff. On an annual basis, we have over 50 research studies taking place, and sometimes 4 to 5 to 6 clinical trials taking place. So I've tried to just give a snapshot of how we have mapped out or how we have organized community, public and policy engagement within our research institution, and our engagement is generally embedded within the research process. In that we begin at protocol development and begin to think about engagement at that particular point. If research requires that we do a community or stakeholder consultation prior to the study being approved, we organize for that. And then once the study has been approved, we get into a CAST meeting, that is Community Engagement Advice for Studies. This is a committee where we sit together with the PI and we plan the implementation of engagement activities. So the small circle sort of like taking us through right from, for example, for the COVID-19 vaccine trial, we started with engagement with review committees and mapped out what needs to be done. And we went all the way to implementing engagement activities and weekly activities, and all weekly meetings to look at what needed to be improved. And there are various teams, obviously, that are concerned about implementing these activities. And I'm happy to respond to any other questions that may come up, but that's a snapshot of how we have mapped out our engagement. Thank you so much.
Thank you so much, Noni. Our third speaker is Dr. Malina Osman. Malina has more than 15 years of teaching experience in conducting research activities in infectious diseases. As a public health specialist by training, and formerly a medical officer in clinical and health settings, she has served as Assistant Director in the Public Health Department of the Ministry of Health of Malaysia, and she's currently attached to the University Putra, Malaysia, and an Associate Professor Medical Microbiology Department, excuse me. Malina, can I hand over to you?
Okay, thank you very much, Prof. Shirley, for the kind introduction. And hi, everyone. I am so pleased to join this webinar in sharing my previous experience conducting all those community trials in the field. Community engagement is the critical entity in public health medicine, not only for the execution of preventive and control measures to prevent the community from getting sick, but also for their commitment to involve directly in the relevant research, therefore enabling the appropriate policies and relevant health mechanisms. So how do we engage them? It depends on few factors, namely the social background of the community, the available technology, and significant role of the presence of the respected figures. Previously, I've involved in 3 major community trials in few parts in Malaysia, multiple micronutrient supplements among the Aborigines children, and then we have IDAT salt supplementation in some rural in Pahang, and then we have recently the effectiveness of the smartphone application in rural areas in the Peninsula Malaysia. For these 3 community trials, what we have identified is that there are 4 major things that we have to anticipate in order for us to have all those community engagement. Number 1, we have to identify all those key person. We know their socio-cultural context. We have to establish the communication as well as collaborate with the intersectoral government as well as all those NGOs. And then for the COVID-19 vaccine clinical trial in Malaysia, it had been started in January of this 2021. But then it is conducted fully by the Ministry of Health. We public health medicine specialists observe from the field of all those information on how they establish the commitment to have all those community being involved. So next slide, I just want to show here. Okay, some of those picture where we involve in all those research, the effect of multiple micronutrients there among the rural Aborigines children. For the vaccine clinical trial, we have very much limited information, but what we have information so far is that because of the information really not to the specific community in general population, so we found that there are certain issues related, certain group that are unable to be engaged at the initial start of the research. Okay, that's all. Thank you very much.
Thank you so much. And then finally, we actually have 2 people, Benjamin Kasiwa, who has dual affiliations with World Vision and the Université Libre de Pays de Grand Lac. And he has worked at the Centre for Research on Democracy and Development since 2014 also. And he currently works on community engagement with the J&J Ebola vaccine trial in Goma in the Democratic Republic of Congo. And Grace Kasereka will be presenting the material on behalf of the team. Grace is a social science researcher with the Sondo Collective, working on public health and education in emergency situations, and has also worked on the J&J Ebola vaccine trial in the DRC. Can I hand over to you both?
Thank you for introduction, and hello everyone. And as Shady just said, I am Grace Kasereka, and as you can see, I am in the same room with Benjamin Kasiwa. We are social scientists from DRC, and we recently worked in the Johnson & Johnson Ebola vaccine trial in DRC. So the vaccine was taking place in Goma, that is the capital city of the North Kivu province, in 2 districts of the town. And in this vaccine trial, the community engagement was a separate branch from the social science, and the social science study operated independently. So the social science aims at understanding perceptions, opinions, and attitudes, and also choices whether to participate in the trial or no, and experiences and concerns of the vaccine trial participants. Only the progress of the work was shared between the 2 teams, as the community engagement was supposed to work independently from the social research branch. And what was like particular for this study is that the social science research started too late, while the community engagement activities started from the beginning of the trial. Next.
Oh. Have I frozen or?
And community engagement was to raise the awareness of the population and to promote participation in the vaccine trial and positive community perceptions about the trial.
Great. Is that
next slide?
I don't think you have another slide, Grace. Thank you. I think that's that. I think we've done there. So I think we're now moving to the roundtable discussion. So I think if we ask everyone or the panelists to have their videos on, what we want to discuss here is some key questions, which I will ask each of the panelists to sort of answer to, and ask the participants in the webinar to share some questions. I will try to monitor those as we as the panelists are discussing. I think one of the first questions we would like to discuss is what are so you've all described the work that you do, which is really, really interesting. I think what would be really helpful to discuss is what are the challenges that you face in conducting community engagement or social science research during the clinical trial or trials that you work on. So I don't know who would like to respond to that first, but just maybe put your hands up. Noni, thank you.
Thanks for that question. I think for us, really, especially for the COVID vaccine trial that we are undertaking, the main challenge has been keeping up with the misinformation, disinformation, and being able to quickly make changes to our engagement plans based on information that is coming to us and based on, you know, what is going on in the globe. So the main challenge is how adaptive are you in your community engagement plans? Can you quickly change them when something new comes up? Thank you.
Oh, that's interesting. Melina?
Okay. challenges that we were facing before, basically because we have a very different set of individuals that have a very different of their background, especially on their attitude, their perception, perhaps biases, preference, level of education, intelligence, yeah, different style of communication. Then we have in Malaysia, we have a multiracial, and we have also the Aborigines group and those marginalized population. So since community engagement is a compulsory in public health medicine, we have to find an access on how we can deal with them directly, so that all those things that we want to deal in the research can be can involve them as what we intended.
Okay, that's a really important point, and we'll come back to that in a follow-up question. Thank you. Mahmood. I think you're on mute, Mahmood.
Yeah, sorry, yeah. I think one of the key challenges actually I have been facing over the years is actually working in your community actually as a native son of the soil. You know, despite the fact that, of course, your role is basically to conduct social science research, you know, there are a lot of expectations at both the community level as well as at the clinical trial. So, i.e., when there are kind of challenges, maybe coming from the community side, you know, you have colleagues, you know, in the trial side, you know, coming to you, at least seeing you more or less like somebody who is more or less kind of playing advocacy role instead of doing social science research, or somebody who comes to you and say, or people will come to you and say, oh, there is this problem in your community. So as a native son, would you go and try to help solve this problem? So there's a question of trying to actually be very, very, very careful in trying to kind of maintain trust, you know, between these two actually key sectors or components, you know, in the society where you work. Because, you know, for example, we actually face a situation that I would term as a relational kind of a segregation, wherein at least you have colleagues, staff who will say, oh, Mahmoud, go and talk to your people. You understand? So at certain point, I became so, you know, frustrated. I said, they are not just my people. They are all of us people, because we work with them. They contribute towards the success of the trial. So we must see all of them as our people rather than, you know, trying to like just push everything to us. So we have this kind of challenge in trying to maintain our work as social scientists, you know, thereby at least, you know, perceiving us as people who play advocacy role. We also have the same thing at the community level. When there are challenges with the trial, they also come to you that we have this problem. Would you please go and sort out this problem for us? So basically, we have this kind of challenges. Working as a native son in the soil, doing social science research, is very, very difficult to maintain trust and to keep balance.
Yeah.
Thank you very much.
Thank you, Mahmoud. And again, I think we can come back to some of those points. Really, really, really important, interesting. Benjamin and Grace, do you, what challenges have you faced? And I have been to visit you, so I do know some of them.
Yes. So when talking about social science in our context, I mean, collecting data from people about their perceptions, there were not too much challenges, but one of the biggest challenges was the general context or environment in which the trial was taking place. So there was like so many rumors about the disease in our context, and so many people were not convinced that Ebola was actually a disease that existed in the community. So there were so many rumors about conspiracy and about business around Ebola, and that made it sometimes difficult to approach people when they knew that you were working for something related to Ebola. So the general context and the public opinion about the disease made it sometimes difficult to work. Thank you.
Thank you, Grace. And a point you raised in your introduction was the delay of the social science research. And can you speak a little bit about what challenges that presented for you, for the team, in terms of you doing social science later in the trial?
Yes. So the problem was that the social science So the social science started so late, and we didn't have much time to like do the field research. And another problem with that was like we couldn't reach too much persons, and sometimes it was difficult because we have like a targeted number per category, the number of adolescents to interview, a number of parents, a number of other people like community leaders, and it was difficult to do all of that in the given amount of time because we started like late. Yeah, thank you.
And just to clarify, that was because of COVID-19, the delay, and I guess for everybody that has presented extra challenges.
Yeah, and an extra challenge that I would like to mention about that is, as you say, the COVID-19 context. So that changed almost everything. Ebola and COVID were both diseases that were not accepted in the community. And the vaccine, the Ebola vaccine, sometimes people could think that it was changed and then it was the COVID vaccine that was now given. So it was becoming more and more difficult to operate in such a context.
Great, thanks. Noni, I see your hand.
So I was just going to add for the social science delay, because we are facing a similar challenge for our COVID vaccine trial, in that we started engagement earlier, and the social science protocol just got approved. And the challenge for us is that the social science helps to inform also the engagement. So we are, I can't say not flying blind entirely, but we are missing those aspects where the social scientists would go out and talk to community members and research participants and dig a little bit deeper into their perceptions, and then help us understand and then improve how we conduct or how we plan out our engagement. So I think it's also been a bit of, it's made us limp a little bit in as much as we have really implemented the engagement activities, but the insights of community members, stakeholders, and participants would be really helpful. They will come in handy now, but a tad late, although not entirely late.
Great, I mean, that's really helpful and interesting. There's a couple of questions in the Q&A. Well, we'll move to another question in a minute, but Brenda has asked, Brenda Okwari has asked, are local research regulators or health authorities embracing the need for community engagement in your contexts? Are you finding that there is support by the sort of regulators or the health authorities? Has anybody got any answers to that for community? Melina?
Yeah, for us, every research need to be approved by the ethics committee, so that all those things related to certain regulation or certain agency need to be taken care. Yeah? So in our setting, it has not much problem, because all those things that being done usually would be have their commitment as well at the beginning of the research.
Okay. Anybody else? I mean, I know for the vaccine trials in DRC and Sierra Leone that this has gone through the ethics approval to support social science and community engagement. And Noni, I think it's really much built into KEMRI.
Yes, as I've said, our protocols, actually the protocol template has a section where you need to put in your either community or stakeholder engagement plans. And specifically for the COVID vaccine trial, we had, I think, about 3 meetings with the ethics, a national ethics committee, and they specifically wanted to hear what engagement plans have we put in place for the vaccine trial.
Thank you. And just one other question, and I think this might, will definitely be for Benjamin Grass and Mahmoud, perhaps is what makes social science in the context of public health emergencies different? You know, what is different about the research? I mean, I know, Mahmoud, you were starting the research during the Ebola epidemic in 2015. Perhaps you can all speak to how is that research different from non-emergency situations?
Yeah, well, I think based on my actual experience late in 2015, doing social science research in the moments of emergency, of course, actually is very, very key, although challenging, you know, because it's a kind of a situation wherein, you know, you're expected to work in the community to see exactly what possibly could be like maybe some significant aspects that needs, you know, to actually get from the community, which could be used maybe like a public health emergency situation, so as to see what is the best approach that could be done, you know, in order to stem or maybe like handle a particular disease outbreak. For example, like in the case of the COVID-19, of course, we have been involved in such situations wherein, you know, we do go out to the community, especially like conducting ethnographic observations, you know, trying to get people's perceptions, you know, people's concerns, you know, about a particular disease, because it's really very, very key, because it is when you are actually able to kind of engage the community, discuss with them so that they share their perception and attitudes or maybe their concerns about a particular disease outbreak, then we'll be able to know when that particular data is analyzed to see exactly what is the best course of approach that is actually done. We have been working alongside with this with the district health management team, wherein we do actually have a weekly kind of briefings, wherein all our ethnographic observations conducted during the course of the week. Actually, on every Saturday, we sit and engage with them and tell them our feedback based on the findings we gotten from the field. Then from there, they see exactly what is the best strategy they could apply. And it has been actually very useful because it helps to change their mentality, because here in Sierra Leone, actually Canberra specifically, social science research actually is a new phenomenon. Actually, it has never been in existence. So, and most of the times, most of our findings, especially those that target, you know, health officials, are actually greeted with some form of concerns, condemnations, or whatever. But at some point, they were actually able to kind of reason and understand exactly the vitality of the work we do and accept them in good faith, and indeed apply the recommendations and the findings, and they see exactly the positive turnout, you know, out of those findings and recommendations we have been given to them.
Great, well, that's really interesting. And I wonder if Benjamin and Grace, you want to talk about having done social science research during the COVID-19 pandemic, and how has that felt different from doing research in non-emergency?
So thank you for the question. So in our experience, the difference is that in emergency, people have much attention on like the emergency. There's a kind of pressure to answer the questions and to find solution for the problem. And in that context, sometimes you are working under pressure. You have to understand things very quickly and to provide responses very quickly to questions that would normally take enough time to study, to observe, and to give answers under a normal situation.
Right, thank you. I have a few more questions, but I think I'm going to go on to the next point, and then we can come back to some of these questions. So, I mean, we're talking about community engagement and working with communities, but as we all know, that the idea of a community is questioned. Communities are not always cohesive units. There are tensions, and groups may be left out. How would you define a community, and how do you work with communities given these challenges? So I think we want to get a sense of how you understand the community and how do you work with that community in terms of your definitions or understandings. I don't know who would want a minute to. who would like to answer that first?
Okay.
Marlena, hi.
All right. Okay, in our setting, community is basically defined as a group of individuals who share similar background, particularly from the socio-cultural lifestyle as well as their belief. Yeah? And then it also depending on scope as well as extent of all those things in each of the entities being defined. And from public health point of view, we are looking for the significant contribution of those factors to the occurrence or the outcome of interest that we are looking for. And particularly during this pandemic, a lot of things that we look at it so that some of those control preventive measures as well as perhaps in this vaccine trial can involve them as much as possible.
Thank you. Mahmoud?
Yes, actually, I would like to define a community as a group of people that live in a geographically defined, territory, with a common culture, customs, sharing the same interests, etc., etc. So, of course, based on this definition, we actually have been working, with this kind of group of people, over the years, actually trying to kind of engage them in our own, social science work, basically like, going to social gatherings such as lorry parks, market centers, Getu, Koyubas, etc., etc., trying to sit with them and discuss with them, basically to get their perceptions, to get their concerns, to get probably their kind of health-seeking behavior, etc., etc. So as for us to be able to learn out of this, out of those kind of experiences or their ways of doing things, so that it will give us a useful kind of information that could be feedback, that could be feedback in the trial via the community engagement team, so that they are able to know exactly the right approach they need to use to work with this community, so that they are able to get their total participation, especially when they are actually engaged by the community engagement team, wherein opportunity is given so that they are able to ask questions that are very critical or very crucial towards the success of the trial. And above all, also with one of our key activities, which is power mapping, it helps us to know exactly, the kind of the power mapping structure in the communities, i.e. both kind of formal and informal titles, because it has been actually like a kind of a norm that when it talks about power, actually people usually concentrate on formal titles. You understand? With less concentration of informal titles. But with the work we do in our community engagement, we are able to know that informal title is also very key and very significant, and it's a force to reckon when it comes to community engagement.
Thank you, Mahmoud. Noni?
So we have a similar definition in terms of geographical coverage. So in Kilifi here, as I've shown on the map, we have a specific demographic health surveillance system area where we have a group of community members, and we do regular research there. But we've also gone further ahead to define our community as a group of people who have a common interest or an interest in health and an interest in research. So that includes politicians, that includes staff of the Department of Health, the Ministry of Health, students, our own research institution staff. So all those form a community. We've broadened our definition to include publics. So now we no longer just engage specific communities, but we also have gone ahead to do what you're calling public engagement, which is just the general public who have an interest. And then policy makers as a different group of people that we also engage. In terms of power play, sometimes we have different levels of groups that we would engage, sit in a common meeting where we get to hear their sentiments and their views, but sometimes we also break them down and have them separate. So for instance, we have administrative chiefs. These these are government people, and we can bring them together in a meeting with just regular community members, and where we get a sense that communication or information is not flowing well because perhaps the community members are afraid of the chief, then we have separate meetings. We have a separate meeting just for chiefs, a separate meeting for community members. So we try to have different types of groupings and meet them separately and sometimes in combined groups. Over.
Thank you. Really interesting. Benjamin and Grace, how do you define community and how do you work with those communities?
Yeah,
more complex
thank you.
I think.
So I think we have the same understanding. The understanding of the community. It's basically a group of people living in the same geographical area and sharing these common interests or challenges. So, and for working in the community, we think that it's important to understand people's needs. So by that, we mean that when working in the community, most of the interventions need to be integrated. If I can go back to our experience in the Ebola vaccine, one of the reasons why people did not think Ebola was real or why the community was not really engaged is that they felt like other community problems were like left out. You know, in terms of priorities, communities and people have other problems. And when it comes to an intervention, like a medical intervention, sometimes people feel like there is much importance that is given on some aspects, while other aspects are left behind. And that's why we can have people thinking about concepts like Ebola business. So we think that in order to work with the community, you have to really understand what are the main challenges. I know it can be difficult, for example, for projects in medicine to work to end war, for example, but at least there must be, like I can say, an attention to all those aspects so that people cannot feel like only one aspect is considered or is given much importance. Thank you.
Thank you, guys. Thank you. We've got some really interesting questions in the Q&A. So I'm going to start with a question which I think links really neatly, and I think to what you were also describing, Noni, and others in terms of working with sort of those in power. So how do you deal with rumor management when it's coming from political leaders? So when rumors are emerging from those in power or political leaders, how do you manage them, either as social scientists or as community engagement specialists? Noni's got
I can give a response because of the current pandemic scenario we are in. So we really haven't had rumors per se coming from our politicians, but we've had questions based on circulating videos. And what we've done is we've mapped out different levels of engagement and who then can engage with. So at our directors level, for example, they would be able, we are a government research institution, and we have a center here in Kilifi with a director, but then we have our headquarter organization that has a director general who have direct links to the Ministry of Health, for example, and the Minister for Health. So we use those channels to be able to reach those particular politicians that are asking questions. A very classical example is last year we had a visit by the Parliamentary Health Committee together with the chairperson, who is a member of parliament, and they came to Kilifi just to ascertain for themselves what is going on. And then when they're back in parliament, then they're able to respond to some of these questions and so-called rumors that come from their colleagues.
That's really interesting. Mahmoud.
Yeah, of course, I just want to kind of use this with a kind of with a practical experience. In 2018, of course, Sierra Leone experienced the general elections in 2018. And of course, in the environment where we work in Cambia, of course, you know, during the electioneering process of campaign period, of course, there are some sort of rumors coming from top politicians actually like saying that they learned that some of our staff actually are kind of actively engaged in political campaigns, etc., etc. And of course, we all know the political dynamics that usually takes place when it comes to electioneering process. You know, so everybody is so keen in order to kind of protect his interest, especially when certain political parties think that, oh, this is their stronghold. So they wouldn't like to see situations where maybe like opposition is trying to kind of penetrate in this kind of environment. So there are those kind of instances, you know, of course, it's brought a kind of some kind of tension, you know, with the trials operations. So as a result, actually as social scientists, you know, getting this kind of information, we are able to kind of do some form of ethnographic observations, not just actually at the political, you know, held there, but also even at community level, just for us to get a balanced kind of information as to where those kind of rumors probably might have actually emanated and got to the attention of those in authority, and then finally to the attention of the trial. So we're able to gather some form of some facts at both community level, and even at some point also try to engage, you know, by way of just trying to get actually what their perceptions or maybe what actually have been their concerns over what actually they perceive as a serious challenge with the work of our colleagues. So we'll try to engage all those kind of, you know, bodies, and from there, what we get, you know, as findings, actually we fed that to the community engagement, because since we are not experts in communication, but basically we are experts in data collection. So especially issues of sensitive of that nature. So we got this information and then we give that to the communication team. And then we have to develop a message around that so that the necessary feedback is given to those in authority for them to see exactly, you know, what actually have been the intent over what they perceive as something, you know, contrary towards our operations. And by so doing, after being engaged by the community, then actually a common understanding was established, and then the issue actually was laid to rest through the intervention of the community engagement.
Thank you. Melina, do you have any sort of thoughts on how you deal with rumors?
Basically, rumors, not that from political leaders in our setting, usually not a real issue, but the rumors usually coming from all those unverified sources that circulated in the society and make some of us confused. So we have a mechanism where the government agencies through Ministry of Health and some of those agencies will be come forward with all those verified information. They would provide all those true information. Then all those rumors usually, you know, being fed, something like that. So it won't affect us so much.
Okay, thank you. And Grace and Benjamin?
Okay, thank you. So I am thinking of what would lead like a political authority be the author of rumors. And our understanding is that it depends on how they are integrated in every action, because we feel like people have interest in everything, especially political authorities. And those interests are not necessarily money, but it can be in terms of power. For example, for this COVID pandemic, one might want to be the one who leads or who plays an important role in the COVID response. So we think that sometimes those rumors can be created by local authorities just because they were not integrated from the beginning, or their interests were not met, or their expectations were not met. So in order to avoid that, it's very important to talk to them and to integrate them from the very beginning, from the planning, so that you understand what they think and how they think they can be engaged. And we think that if local authorities are really engaged from the beginning, they are not very likely to be authors of rumors. Thank you.
That's really helpful. Gosh, I feel like we could talk for hours, but I think we've got time for one more question. There are a few other questions that hopefully we can answer outside of the webinar, but Sarah Edwards, hi Sarah. What do you feel your responsibilities are to the members of the community as community engagement experts and as social science researchers? So what do you feel, what do you, maybe as individuals and institutions feel as your responsibility to members of the communities that you're working in? Is that clear? Who would like to answer?
Sherry?
Yeah.
The question is not very clear for me. Can you please?
I think so. The question is, what do you feel your responsibilities, so your and Benjamin's responsibility to members of your community as social scientists? Because I know you have a care and concern for your communities, having seen you at work. So what do you feel your responsibilities are? Noni, did you have something to answer first? And then I'll come to you, Maud.
Okay, yeah. So I think for me, it's similar to what Mahmoud shared. I'm a part, this is my community. I come from the community where we work, and I feel as if I have a responsibility to ensure that community members feel respected, they feel part and parcel of the process, and that they are involved genuinely in the process, and not a tick box type of involvement where just so that is something that I have to ensure is happening within the institution, and that researchers understand that clearly, but also a responsibility to ensure that our communities where there is low understanding of health research and the value of health research, that understanding is built up, so that when they are making decisions to participate in research, they are doing that from a point of understanding and a point of knowledge.
Thank you. Thanks, Noni. And I've got 2 more minutes, so I really want to hear from everyone. Mahmoud?
Yeah, I think actually my key actual responsibilities I owe to the community or my communities. One has to do with trust. Trust is actually very, very key, because with trust building, then definitely confidence is there. Then at the end of the day, you'll be able to get some kind of positive actually participation from the community. And of course, living up to expectation is also very, very key. Of course, if you are able to live up to expectation, then definitely trust is built. Because if actually like you come to the community and you say this, then at the end of the day, what actually comes out is completely different, especially, for example, like the issue of maintaining participants' confidentiality as a social scientist is actually very, very key. So if the opposite happens at the end of the day, then you break trust. Then the sooner you break trust, then definitely you have collapsed the whole system. And of course, transparency is also very, very key. Your community should be able to see exactly through whatever that you do in the community. You must not give them the feeling that you are doing some shady deals, or probably you are doing things that actually that will raise concerns, that will begin to create another avenue for rumors, because you are there as an expert to track rumors, to get people's concerns or whatever. So in the process of so doing, you have to build trust, and you have to kind of ensure that you live up to expectations. So these are actually key qualities that actually I think as a social scientist working in my community, I owe to them so much.
Wonderful.
Thank you.
Melina?
Okay, community engagement is compulsory in public health medicine. So our responsibility is that we have to continue empowering the community so that they can choose the best decision in order for them to have a quality of life, particularly from the health and medicine point of view.
Thank you, Melina. And Grace, Benjamin? Oh, I think they're frozen. Oh, no, you're there. Grass. Just last point on what you feel your responsibility to the community is, or your community.
Yes, we think that as social scientists, our responsibility is like to be the bridge between the scientists and the community. And by that we mean heard and taken into consideration when interventions are implemented, because sometimes there is a gap between like the scientific understanding and the community understanding. So as a social scientist, we need to be like the bridge between the two and make sure the community is heard and also the community understands the purpose of the intervention. Yeah, thank you.
Wonderful, thank you. Wow, I wish we could talk for hours. Your experience and insights are really, really interesting. And yeah, we've got a few more minutes. So we've got some concluding points that the panelists have put together. So we hope that these will be useful for you to sort of think about the key issues that have been raised in this webinar. I think, and these are combined points to conduct social science research before trials start, to understand context and community dynamics. And the panelists feel this is really important, to leverage community engagement practitioners and social scientists who know the context and can understand communities' perspectives and experiences. And I think it's been very clear from our panelists that as Mahmoud says, native of the soil, isn't it? Having that absolute insider view is really, really important. Involve all layers of trusted community leaders in the sensitization and awareness process. So some of the discussions around mapping power and engaging with leaders. Work with existing health system vaccination programs to gain trust from the population. And conducting trials in both urban and rural settings and across social economic groups. So where the trials are conducted and who is involved in the trials are really important. Use very clear communication and different modes of communication. Understand how communities evolve and our dynamics. So I think it's very clear from all our panelists that this is an ongoing process, both of social science that is constantly feeding in to a dynamic process of community engagement. And drawing on key principles like humility, openness, and investment in communities to build long-term relationships of trust. Again, something that's been very clear from all the panelists. I'd like to thank you all very much for your participation and the excellent questions. There are other questions. I'm not sure how we're going to answer that. The link to the webinar recording we published on the Coalition's website. And when the webinar closes, you'll be directed to a brief survey, and your feedback on this will be really, really valuable and much appreciated. So I just finally want to thank our amazing panelists. You're all doing such amazing work, and I'm so glad we got to showcase your work. And thank you so much for your time and sharing. Thank you all.